Hi, my name is Matt Colucci, and this is a presentation on the ethical responsibilities surrounding the environment of the medical professional. In this presentation, I'll use my experience of shadowing my dentist, Dr. Christopher Haggerty, to help illustrate important ethical responsibilities of dentists that can be applied across the entire medical spectrum. While shadowing with Dr. Haggerty, who is pictured to the right, I learned a great deal of both dentistry and the medical environment. Primarily at my experience site, I witnessed the removal of oral cysts, dental implants, insertion of bridges, and so on. But questions I primarily asked included what kind of ethical responsibilities were to be considered by a dentist. Ethical standards in any professional setting must be given the greatest amount of consideration. For medical professionals, the same rule applies. At my experience site, I found that Dr. Haggerty being honest with patients about their specific diagnosis or medication distribution was especially crucial in the dental setting. Each and every time I watched Dr. Haggerty meet a patient who had symptomatic complaints that couldn't be visualized, it was important to him that he made the proper diagnosis no matter how bad the patient complained. For example, at my site I witnessed a few angered patients who didn't get prescribed certain medications because there was no evidence of an infection. Dr. Haggerty carelessly prescribed a powerful antibiotic without evidence of an oral infection. It could not only hurt his image, but it could also cause the patient more harm than good from side effects. In the case of an infection, many antibiotics can cause unwanted side effects, and misuse can also cause bacterial resistance in the future. I recall learning a great deal of content from Bio 152 with Dr. Boris about the rise in resistance to antibiotics, and found it intriguing that both him and my mentor were on the same page about carefully prescribing and properly using these medications. Another issue Dr. Haggerty enlightened me on was how intertwined prescription of opioids are within dentistry. Dr. Haggerty said many young dentists fail to recognize when patients are using the system to essentially get prescribed multiple painkillers. In response, the state of Rhode Island has established an online prescription drug monitoring program for dentists and other medical professionals to utilize so that they can track the use of controlled substances that are prescribed to their patients. Not only can something such as a misdiagnosis lead to a snowball effect in terms of health issues, but it can also cause the medical professional's place of business to engage in long and expensive legal battles. According to Forbes magazine, over $3 billion were spent in payouts in 2012 for court cases involving medical malpractice and negligence issues. In conclusion, my experience at the dentist office enlightened me about the importance of honesty in any professional setting. I specifically noticed that some of the patients with some of the worst cavities or infections were actually some of the most friendly and interactive patients. I think it was Dr. Haggerty's reputation for honesty with his patients that makes them feel comfortable, allowing him to seek the safest and most effective course of treatment, which in my opinion is the goal of modern medicine.